Thank you, and you have the floor.
Thank you, Chair, and apologies for the technical difficulty. I have a couple of additional points to what my colleague Carolyn has said. We as NGOs fear that the focus on funding means that we are ignoring key policy challenges. While it's true that we have a shortfall of funding on the ACT-Accelerator, we have to acknowledge that there is a massive gap in manufacturing and supply to LMICs. For diagnostics, for example, 120 million antigen rapid diagnostic tests are only a part of actual need and manufacturing capacity of the two companies providing antigen RDTs under the accelerator. It was a privilege to hear the words of Sabine Nsanzimana from Rwanda about how critically important diagnostics have been in the response there and the fact that they have managed to limit deaths. And yet we continue to see constrained funding towards diagnostics on the ACT-Accelerator. To make these tools globally scalable, we need to maximize all the tools available to us. We need to share technology and enable technology transfer to manufacturers in the Global South. The CTAP, or COVID Technology Access Pools, seems paralyzed by a lack of political support from research institutions and pharmaceutical companies. If resources remain severely constrained, we will need to shift priorities. The volume guarantee approach will not work long-term if resources are not drastically increased. And in such a situation, suppliers and innovators should openly license to qualified producers. Tech transfer to LMICs is the only way to scale production to the levels needed and to beat this pandemic. We call upon member states to insist that deals under the ACT-Accelerator include tech transfer provisions and increased scrutiny on manufacturing capacity and actual need of treatments, diagnostics, and vaccines in their countries. We express disappointment that a number of countries have expressed opposition to the COVID patent waiver proposed by India and South Africa. In the past, those who have opposed overriding patents often use the excuse that TRIPS flexibility should only be used in emergencies. The question is, what is the excuse now? What larger emergency is there than this global COVID-19 pandemic, which in turn is causing a global economic emergency? A patent waiver benefits us all, even high-income countries that are opposing this. We think it's important to remind member states that the alternative to the patent waiver is approaching each COVID technology with a compulsory or voluntary licensing approach. This is a time-consuming approach that is at odds with the need for us to prevent mortality and reopen economies in this pandemic. This approach ignores the financial and power disparities that exist between countries in access to health technologies. And if we don't waive these patents, at least temporarily, we will continue to see reduced access for LMICs compared to wealthier nations. Political leaders at the start of this pandemic spoke at length about these technologies being global public goods and underlining that the ACT-Accelerator was about solidarity. True solidarity within this accelerator cannot occur without eliminating these important policy and political barriers. Thank you.
Thank you very much. And